I'm excited to welcome you back, and I'm happy to introduce you to Dr. Susie Baldwin, Medical Director for the Los Angeles County Department of Public Health Office of Women's Health. Dr. Baldwin is a preventative medicine specialist who works as Medical Director for the Office of Women's Health at the Los Angeles County Department of Public Health. Her team focuses on issues impacting women's health, equity, including sexual and reproductive health, gender-based violence, human trafficking, and women's health epidemiology. Welcome, Dr. Susie Baldwin.
Thank you, Rebecca. Hi, everybody. I'm so happy to be with all of you here today. And thank you again to our morning panelists. That was a really powerful session that we all just experienced together. It really brought into focus the pervasive issue of domestic violence in our society and the health impact. And for this current session, we're going to switch gears to talk about one specific health issue, which is impacting all of our lives still, and that is the COVID-19 pandemic. This is an unprecedented time in world history, in our national history, and unfortunately, many of us in the room have suffered personally and profoundly from this pandemic. So to those of you who have lost people, who have been ill yourselves, who have experienced long-term health impacts, or some of the social and economic impacts of the pandemic, we are sorry for your suffering. And today we're going to, as I said, focus again on some of the impact of the pandemic on intimate partner violence. We have three fantastic speakers for this session. We are not going to do this in a panel format. We're going to have each speaker do their presentation with some Q&A and then move on to the next. So without further ado, I will introduce our first panelist. We're happy to have Dr. Maya Ragavan with us. Maya Ragavan is an assistant professor of pediatrics at the University of Pittsburgh. She's a general pediatrician and community partnered researcher whose work centers on understanding how cultural and structural racism impacts survivors in intimate partner violence. Thank you, Maya, for being with us today from across the country. And we look forward to hearing your presentation.
Yes, thank you so much. I'm so grateful for the opportunity to present to all of you today, sharing some research that that myself and a large multidisciplinary team worked on about the impact of the COVID-19 pandemic on IPV survivors and their children. So what this research So we sort of started with this idea way back at the beginning of the pandemic, which feels like so long ago, because we were really hoping to understand what kind of new and innovative practices were popping up around the country, and really wanting to hear from IPV advocates about what was happening on the ground level and how what kind of resources and other sort of other things they needed to continue doing the amazing work that they were doing. And as the pandemic has continued, I think I really see this research as a way to preserve this history, to preserve the history of what happened during this pandemic, to preserve sort of the syndemic sort of framework here where, you know, and I'll talk about this throughout the presentation, but where a lot of advocates were talking about the pandemic of structural racism, IPV, and COVID intersecting. So really to sort of to preserve the history and to amplify the stories from advocates. So I really see myself as someone who's a messenger here, just really wanting to amplify these stories and share them with you. I'm also very cognizant that I'm in a room with so many advocates, and I'm just so deeply grateful to all of you for the amazing life-saving work that you've been doing during this pandemic. Next slide, please. So, thanks. So I don't have any disclosures. I want to just acknowledge Angelica Escobar, who's a medical student I work with, who did some of the black and white illustrations that you'll see throughout the presentation. Next slide. So I don't want to spend too much time on this, but I do want to just point out some of the recent studies that have come out looking at the increase in IPV severity and frequency during the COVID-19 pandemic. And so just a couple of studies to point out. There was a meta-analysis or a synthesis of 18 studies that showed that during the COVID-19 pandemic, there was an increase in IPV frequency and severity. And a lot of those studies really centered on police reports. And as we know, police reports are not a representative picture of the experiences of IPV survivors during the pandemic, but that's what a lot of the studies to date have really looked at. I did want to point out a study that showed a different finding because it was such a well done paper, and I just wanted to share it. So it was a study, also it was police reports, but it actually showed an overall decrease in IPV-related police reports during the pandemic. But when they stratified by race, they found that those decrease in police reports were primarily in majority Black identifying communities. And so I think that really sort of amplifies the idea of sort of the intersecting how structural racism and COVID have intersected during the pandemic. And so that, yeah, I just wanted to sort of share those studies before I launch into talking about the study that I worked on. Next slide. So we know that IPV is so much rooted in power and control. And when we were conceptualizing the studies, I think probably everybody here was thinking about is sort of how is COVID-19 being used to control and manipulate survivors and their children. And we were thinking about it both in terms of how abusive partners were using COVID-19 to control and manipulate survivors, and also how oppressive policies and practices were intersecting with this pandemic to control, manipulate, discredit survivors. And so we were focused on that question. Next slide. And so I want to share sort of the members of our team. So this was a multidisciplinary collaboration between Futures Without Violence, the American Academy of Pediatrics, the University of Pittsburgh, which is where I'm from, and Children's Mercy Kansas City. And we were funded by the Centers for Disease Control and Prevention. So this is our full research team. Next slide. And one of the other pieces of this study is we leverage the wisdom and expertise of a multi-sector stakeholder collaborative of 30 different organizations. We included many culturally affirming organizations. The overall study was focused on the intersection between healthcare, domestic violence, and child abuse. And so we had organizations representing those three sectors. Today, I'm only going to be speaking about the part of the study focused on domestic violence, but our collaborative met once a month, provided guidance and thoughts on feedback, and also our supporting dissemination efforts. Next slide. So the objectives of our study, as I've mentioned, were to understand the impact of the COVID-19 pandemic on IPV survivors and their children. And as I mentioned more broadly as well, on children experiencing abuse and neglect, although I'm going to focus specifically on IPV. We also wanted to examine how IPV agencies and Child Protective Services more broadly have adapted to the pandemic and learn emerging practices happening around the country. Next slide. So for the IPV-focused part of this study, which is what the part that I focused on, participants in the study were those who identify as IPV advocates, who work directly with IPV survivors and their children, and who work at US-based agencies. We also, so we recruited primarily actually through word of mouth and personal invitations, really leveraging the deep community networks of Futures Without Violence. And part of the reason that we did that is we wanted to ensure equitable inclusion of smaller IPV agencies, of culturally affirming IPV agencies, and of IPV advocates who work with survivors who identify from communities who've experienced marginalization or who have multiply marginalized identities. Next slide. So, we created an interview guide that was aligned with our study goals that I mentioned, and we conducted all these interviews through Zoom, and they were all audio recorded, and we used an inductive thematic analysis approach to code and analyze the interviews. Next slide. And so we interviewed 53 advocates total. So like I mentioned, we wanted to be very intentional about ensuring that the advocates that we heard stories from were supporting communities that have experienced marginalization. And so focusing specifically on survivors who identify as Black, survivors living with disabilities, survivors identifying as immigrants, survivors speaking languages other than English, survivors who identify as LGBTQ+, and survivors who identify as Indigenous or Native American. We also, so that's kind of the first slide here. The race and ethnicity, this is of the advocates. This is the way that the advocates identified, and then the gender, again, the ways that the advocates identified. So the majority of advocates identified as female. Next slide. And then we also wanted to ensure representation from IPV agencies around the country. And so this map just shows the where the IPV advocates were working at the time that they completed the interview. So we were able to recruit advocates from around 26 states. Next slide. And so now I want to share some of the stories that the advocates shared with us. And I'm going to do that through sharing some quotes. So many of the advocates shared how the COVID-19 pandemic has impacted IPV survivors. A lot of it was centered on isolation. So this advocate was saying, there has been a lot of emotional impact on the survivors that I've worked with who are already experiencing isolation due to the abuse, and that only increased because of the shelter-in-place orders. So a lot of discussion about isolation and how IPV agencies were working to combat kind of the compounding isolation during the pandemic. Next slide, please. And then a lot of discussion about how COVID-19 was being used by abusive partners as a way to assert coercive control. And so there were a lot of different examples provided how IPV survivors were not being given access to healthcare, to PPE, how IPV survivors were being gaslit around their own sort of mask wearing, and also a lot around child custody and coercive control in that space. And so that quote centers kind of on that last point. So this advocate said, when COVID hit as hard as it did, the abuser was saying that they weren't comfortable exchanging the children on the weekends anymore, so she wasn't able to see her children except by FaceTime. So there were a lot of examples of how COVID was being used to control survivors. Next slide. And then so much of what emerged was what I was speaking about a little bit earlier, and what has been discussed so eloquently throughout this whole conference so far, which is really the way that structural inequities have been compounding upon the pandemic, and the way that has been impacting IPV survivors. So this quote is from a advocate who works particularly with South Asian immigrants, and they said it was hard to really manage and find resources for undocumented survivors in the beginning. Was by far the hardest because there was nothing. When you lose your job, you go to unemployment, you get unemployment, you get food stamps, you get all of that when you're documented. When you're undocumented, there is nothing at all. Next slide. And this quote, which again amplifies this idea of syndemic or multiple pandemics, is from an advocate who works with Black trans survivors. And they said, I think especially when talking about the Black trans women that we serve in combination with COVID and DV and what's going on in the US right now, we don't want someone to call our hotline and our first response to be to call the police. I think especially with COVID, when their other resources aren't around as much, it really limits their access to be safe. And so many of the quotes really highlighted as we all know, and as we've all been seeing, sort of the exacerbation of structural inequities during the pandemic, especially for survivors. Next slide, please. A few advocates mentioned the importance of balancing safety and sort of healing-centered trauma-informed approaches. And so some of this was around mask wearing, which all the advocates absolutely advocated for, but wanted to share a few examples of situations where survivors, particularly those who have survived sexual assault or strangulation, were triggered by mask wearing, and how advocates were being creative and supportive to survivors. So this quote is from an advocate who said, "Our mask wearing policy, we have found that wearing a mask can be really triggering for someone who has experienced suffocation or maybe someone who has had their nose broken." And so they go on to talk about how they were very intentional about their policies to ensure safety for everyone, but also to ensure that survivors were safe. Next slide. A lot of discussion, as you can imagine, about privacy and virtual visits. So I think we all just sort of went virtual all of a sudden, and there were a lot of opportunities there that advocates discussed, but also some challenges. There's so many quotes about this, but I wanted to just share some discussions about privacy and some of the ideas that advocates shared around using code words, texting, and really being careful when conversations are taking place. And so this advocate said, "Some folks still want to speak with us, but we are fully aware that they are or may be cohabitating with an abusive person, and we need to be a little careful in that." Next slide, please. And then one of the things that emerged, and it emerged sort of organically because we didn't go into this study thinking about this, is the first question we asked is, "How are you doing as an advocate?" And we heard so much about how advocates were doing during this time, how advocates were, the amount of work and energy and resilience they were pouring into their job, and how so many of them felt like they just were not being recognized as frontline workers. And so there was so much richness there that we added several questions on that and really spent some time thinking about, okay, how can we preserve the stories from advocates and use this so in the future, if and when this happens and as the pandemic continues, we can support advocates as well. And so this quote is from an advocate who has a little girl, and this is about working from home. And so this advocate said, "I picked up my daughter at daycare and her babysitter has eczema. She had an outbreak on her neck. My daughter, who doesn't even know her shapes, sat in the women's lap and said, 'Is your boyfriend hitting you?' My 3-year-old is now screening for intimate partner violence in actually a very empathetic and correct type of way. I was super proud of her, but as soon as that happened, I knew that she was hearing me talk about this stuff too much." And so there's so many quotes from advocates just sharing what their experiences have been like. Next slide, please. And then really a lot about community resilience and social support, which I'll share this one quote, but there were so many. So this was from an advocate who was talking about community resilience and about how survivors and members of the community have utilized social media to crowdsource and share resources. But there was a lot of stories of resilience, both from the standpoint of individual survivors, advocates, as well as community level resilience. Next slide, please. And so, I think I've gone through some of this, but really there was a lot that came out about how COVID is being used as a way to control, manipulate, and gaslight survivors. There are a lot of challenges and opportunities related to virtual provision. Like I've mentioned, really the syndemic framework about how structural inequities, COVID and IPV have compounded upon each other. And then a lot of discussion about resilience and social support, as well as workforce wellness. Next slide. And so in terms of next steps, so I think one of the things that emerged so much from this is a need for cross-sector collaboration, which is exactly what you all, what this wonderful conference is all about. And one of the things as a pediatrician that emerged that was really surprising is, no one talked about healthcare. No one talked about healthcare. And I think that that's so interesting and just shows how much we as healthcare providers need to lean in and leverage the support of IPV advocates and agencies, but also continue making enormous strides forward in supporting survivors and building those cross-sector collaborations. There was so much, I think, here in how do we include IPV in disaster preparedness and emergency response plans for the future. Importance of developing technology that allows for safe, confidential, and private conversations. A lot of importance, I think, in a lot of in funding and supporting IPV agencies, particularly culturally affirming IPV agencies, and then really supporting IPV advocates and prioritizing them as frontline workers, as critical members of the healthcare workforce, both for PPE and also for vaccinations. And so those are some of the implications. I think the other one, as I mentioned, is I think it's so important to preserve these stories. And so I was so grateful for the opportunity to be able to talk with advocates and preserve some of these stories. And thank you for the opportunity to speak with you as well.
Thank you so much, Maya, for sharing that really insightful and wonderful data. Before we introduce our next speaker, Dr. Ferrer, we're going to do a couple of questions for you. So to start with, I appreciated you recognizing the role of frontline DV advocates and those who have been on the ground trying to help their clients throughout this really difficult year and a half. So our DV advocates are exposed to secondary trauma or sometimes have to relive their own trauma day to day as they support other survivors. Was there anything that emerged in your interviews about the experiences of frontline workers and ways that they managed to cope and find support during this difficult time?
Yeah, absolutely. And I couldn't agree more. And again, just so grateful to all the advocates here for the amazing work you do. Yeah, I think there were a lot of sort of recommendations for workforce wellness. I think one of the things that emerged, and I didn't share this data, but one of the things that emerged is that many advocates felt that their agencies were really coming up with innovative strategies, whether they were allowing for flexible job hours. There were some advocates who talked about how everybody had an hour a week to see a mental health provider if they wanted to. That was their choice, but if they wanted to, but that was just part of their schedule. And then like really to try to integrate the advocates together, because one of the things that came up was that when advocates weren't going to work, they couldn't have that space to talk with other advocates about what was going on. Like it felt very isolating and all that trauma was in their home. So making sure that that advocates had that space to talk with one another. But those were some of the things that emerged. But yes, a lot of discussion about recommendations for workforce wellness for sure. Susie, I think you're muted. Were you? So sorry.
Thank you. Do you have time for one more question before you hop off?
Absolutely. Yeah, of course.
Sure. So another question. You did acknowledge the role of healthcare providers, and we haven't talked too much about that role today so far. Is there any insight you can share from interviews about the partnerships between advocates you interviewed and healthcare systems?
Yeah, absolutely. And, I'm a healthcare provider myself, and I feel so strongly about our role. I think like I was mentioning, healthcare providers really didn't come up. And I don't know if that was because we didn't explicitly ask. And so I want to acknowledge that. But they didn't come up. They did not come up as a source of support. And I don't know if that's because we didn't ask or because it means that we just have so much work to do as a healthcare system to continue to support survivors and build those collaborative partnerships. And I know, Futures leads the way, and so many other organizations, and there's so many amazing collaborative partnerships. So I really don't know if it was because we just didn't ask that very explicit question. But I think there's a lot. I think one of the things that I've been doing is really presenting this data a lot to healthcare providers and using it then as a way to segue into, can we continue to make our spaces healing centered? Can we continue to use a universal education and resource provision approach and really continue building collaborative partnerships? Really to show this is what the experiences have been like for survivors, for our patients, for our families. How can we as healthcare providers play a role in supporting families and supporting the work that advocates are doing?
Thank you so very much. It was wonderful to have you with us today.
Thank you so much. I appreciate the opportunity. Bye.
Bye.